Personally, I smoke cigarettes.
Right.
I love cigarettes.
Right.
I definitely know they're not good for me. I know I
Right.
should stop smoking at one point,
Right.
but right now that doesn't quite concern me.
Right. I got
I like
you.
the way it feels. I like the culture. I like everything about it. But about a year ago, I picked up an e-cigarette, just for the fun of it,
Right.
and I used it for a bit. And for about 2, 3, 4 weeks, it really did cut down on my cigarettes.
Right.
And I'm not sure whether it was placebo or not.
Right.
But as soon as I left the e-cigarette at home, I bummed a cigarette and I was back on cigarettes. Do you see a problem with people using it simply as a substitute or an addition to the repertoire?
I don't have a problem with people smoking cigarettes. You're going to find that surprising. But that, as you said, you smoke cigarettes, you like it, you know that there's a risk involved. And okay, so there's a risk involved, and now you know it, and at some point something may happen which will convince you the risk isn't worth taking. But I think people knowingly taking risks is not a problem. I think people unknowingly taking risks is a problem.
You talk about letting people make their own decisions, letting consumers make their own decisions. Do you think consumers are smart enough to analyze a risk, take the risk, and then live with that risk?
So when you say analyze risk, then I think that we sort of make up how much people analyze risk. So unless you live in a cave, you know that smoking increases the risk of an early death. But mostly people don't live their lives thinking about risks, that they know that there are risks. So there are people who ride, their bicycles in Boston. And if they stopped for a moment and thought about what the risks were, they wouldn't do it anymore. So, so I'm not opposed to people taking risks. I'm opposed to people taking risks that they don't know are risks. If you look at e-cigarettes as risk reduction devices, that there's a concept in public health of risk reduction as opposed to risk elimination. So there are people who are into abstinence for all things and people who are not into abstinence. So there are people who are into abstinence for alcohol. There are people who are into abstinence for sex. There are people into abstinence for drugs. And then there are people who believe that all of those things could be done reasonably and that it should be done safely. So back in the earlier days of HIV infections, before things like needle exchange became accepted, many public health people were opposed to needle exchange. That comes as a surprise to a lot of people now. But the thought was that what we want to do is get people to stop using intravenous drugs. And so we shouldn't give them clean needles because that won't stop them from using them. And that was wrong. That was like crazy. The Department of Public Health in Massachusetts was opposed to needle exchange programs. And it was an awful thing. I mean, it led to the deaths of people. Because needle exchange is a way to reduce risk, not to eliminate it. And e-cigarettes are an example of this. If you're going to inhale something, it's better not to inhale burning paper and burning tobacco. That we know that tar is a byproduct of burning paper and burning tobacco, and without that, that reduces the risk of cancer by a lot. There's no question about it. But it doesn't appeal to the abstinence-only crowd. People who think that you shouldn't be inhaling anything.
If it looks like a duck, it quacks like a duck, it's probably a duck.
That's exactly right, that it looks like a cigarette, and therefore people who do this will start smoking cigarettes or it won't reduce cigarette consumption. The question is, who cares? That people who use this are clearly not at risk of any kind of substantial harm. That nicotine is not the harmful part of the cigarette. Nicotine is not the thing that causes cancer. Nicotine is not the thing that causes emphysema. Burning tobacco does, and if people will use tubes of nicotine that don't burn tobacco, they'll be better off and the public health will be better off.